And the bard that Shakespeare said it all. In Mark Antony's speech, there is a phrase, the evil that men do lives after them. The good is often interred with their bones. This is true for vaccines as well as humans. Because what is the outcome of a successful vaccination program? There is non-event, there is no disease. No disease is a non-event. So it becomes very difficult to identify, to quantify, it becomes an abstract thing, there's no event. But even if there's a rare side effect, the evil part of it lives after them, for men also and for vaccines also. So this is the paradox, because the successful vaccine causes a non-event, unsuccessful vaccine causes a side effect. So uh, it accumulates, the side effects accumulates. And then, as I said, this recent adverse publicity and loss of trust in vaccines. This is a paper written by no other, one of the co-authors rather, Stanley Plotkin, who is the editor of the standard book Vaccines. So this is these. They also have considered in this paper published in New England Journal of Medicine that the loss of trust in vaccines after the thoughtless vaccination strategies such as the hurried vaccine nudges against COVID-19 have caused concerning adverse events like myocarditis, blood clots, leading to a growing distrust of vaccines, even against those which may have some benefit at the population level. So these have been the recent setbacks. So it is a challenge to win back the trust, and a challenge to plan the strategies which will sustain trust. So the perspectives about vaccines also vary according to personal experience. There is a saying that two men look out through the same bars, one sees mud and one sees stars. Is a quote that conveys the idea that people don't see things from the same perspective. If a person has experienced a death of a child from a vaccine predictable disease, he or a doctor sees that he or she will face the pain of a loss which could have been prevented. On the other hand, there are side effects, though rare. And if a person or a doctor sees a parent with a child who has been disabled due to adverse effect of vaccine or perhaps died, so that pain is also equally sharp, perhaps more, because a healthy child, you are giving vaccine to a healthy child. It is you have to be extra cautious and win the trust, because medicine you are giving to a sick person. So already there is some risk, so one can reconcile the person was suffering. But if you are thinking of vaccination, you are giving it to a healthy person. So that is an entirely different, the whole perspective changes. Ki healthy person who might not have got the disease in the first place. Secondly, even if it had got the disease, they would not have succumb to it. But if a vaccine it causes harm, it's a big tragedy. Perspectives are shaped by personal experience. Health workers in underprivileged regions may witness numerous vaccine preventable child deaths, while affluent communities might not encounter these deaths, regardless of vaccination status. As I said, as a socioeconomic status improves, the vaccination coverage also improves, the standard of improves, the preventable deaths are not taking place. So they don't see those deaths, but they see the rare adverse events of vaccines. So their perspective would be that yes, the vaccines can cause more harm than good. Whereas in underprivileged places where there are lots of deaths, health workers, their perspective will differ. So another thing is a very something which I do not agree with the even the WHO has termed this vaccine hesitancy, which is sort of stigmatized. So I think that vaccine hesitancy is a logical thing, because any new vaccine, you have to weigh the benefits and the harms. So you have to look at both sides. I mean, when you are crossing the road, look at the left side, right side, then you cross the road. You cannot, do not call it pedestrian hesitancy. So similarly, this vaccine hesitancy word is improper, because any rational person should be hesitant of a new thing. And the way to deal with vaccine hesitancy is not to eliminate hesitancy, but to clear the doubts and ultimately leave it to the person after giving all the facts. So I also do not commit either way, because I have seen both. I have seen deaths from preventable disease. I have seen adverse events. I have met parents who lost their children to adverse events. So when asked about views of vaccine, the response should be tailored to the person. To a strong advocate of vaccine, if a person is totally that vaccines are only good, I always tell them that one has to think of the side effects. One has to think sometimes serious side effects. And then how strong is the evidence and efficiency? Where is the literature? What are the alternatives? What are the treatment available? So vaccine, a strong belief in vaccine also, one should generate some hesitancy so that the other side effects are not ignored. And to a person who doesn't believe in vaccine, I would like health workers to emphasize the benefits of proven vaccine and give the facts and figures about mortality, morbidity, risk of the disease with exact facts and figures rather than propaganda. And leave both parties agitated and vaccine hesitant. Science has residual uncertainties. That is actual science. Science is never settled. Certainty is tends towards faith, not science. So science is always uncertainty. The vaccine hesitancy is a part of science, and it should be explored by both parties, those who believe in it and those who do not believe it, and then they should come to a consensus, or they should come to what are the facts and figures, and the decision is left to the person. So as I said, the Plotkins, who is the authority on vaccines, this is the textbook. It's the 8th edition. Since decades, this is the standard textbook. So this recently in New England Journal of Medicine, July 2024, couple of months back, a paper has been co-authored by Stanley Plotkin, in which the title is Post-Authorization Vaccine Safety Research Requires Adequate and Timely Funding, directly linked to the introduction of new vaccines, just as vaccines for children and vaccine injury compensation program funding is. So they have expressed, including Plotkin, they have expressed, this is from the paper, the widespread vaccine hesitancy observed during the COVID-19 suggests, as I had said in the introduction, that suggests that the public is no longer satisfied with the traditional safety goal of simply detecting and quantifying the associated risk after a vaccine has been authorized for use. The public also wants authorities to mitigate and prevent rare but serious adverse reactions, which no longer seems rare when vaccines are given to millions or billions of people. Addressing this in a transparent manner will increase vaccine uptake. So rather than stifling vaccine hesitancy, it should be open discussion. And Plotkins has also admitted that there have been little post-marketing research on the adverse events, and no fund has been earmarked till now. So there is a gap. So these are the from the same paper, understanding adverse events following immunization. That is, he had mentioned in the paper, the authors have mentioned in the paper that many side effects, we do not know the biological reasons behind those side effects. Understanding the biological mechanism. So like they have listed some of the vaccines, the oral polio vaccine, it causes sometimes vaccine associated paralytic polio. It's in few instances, right? So it is understood that because the particularly oral polio vaccine is a live virus, so they attenuate it, they make it harmless, but sometimes it mutates back to the virulent strain from the vaccine strain. So that can cause paralytic polio. And that is why now they are replacing the live vaccine with the injectable vaccine. So the risk of respiratory polio is eliminated. Then swine flu influenza vaccine, it causes Guillain-Barré syndrome. Most of the influenza vaccines and even the COVID vaccines, some of them cause Guillain-Barré syndrome. The mechanism is not understood. So that is serial number two. Then rotavirus, rotacil, the vaccine against rotavirus, it causes intussusception, the telescoping of the intestine into each other, which causes intestinal obstruction. It is called interception. It is not understood. Then inactivated intranasal influenza virus can causes Bell's palsy, paralysis of the facial muscles, hypothesized but uncertain how it causes. Pandemic influenza vaccine, narcolepsy, not understood. Sleeping, COVID-19 vaccine, it causes myocarditis. And it is not understood that we require more research. It's a new vaccine. Then AstraZeneca vaccine, thrombosis with thrombocytopenia, and now AstraZeneca has withdrawn this vaccine. Hypothesis was uncertain, blood clots. So you see, there is a these incidences are occurring because large number have been given. So it is a rare, but it adds up. It appears common. Then the withdrawal of AstraZeneca by the manufacturer. All this has caused erosion of trust in the people and vaccines. So we have to build it back by transparency, not by censorship or suppression. Then Guillain-Barré syndrome by the AstraZeneca vaccine, AstraZeneca and Johnson vaccine. Guillain-Barré is not understood. Then GSK Pfizer respiratory syncytial virus vaccine, Guillain-Barré not understood. So this Plotkin and his co-authors have brought out that so much research is required to understand the biological mechanism so we can make the vaccine safer. Once we vaccine safer, we will have better uptake. So this strategy of is a long term. It is not like social marketing or selling Coca-Cola or Thumbs Up, calling some film stars and pop stars. So that is short-lived. In fact, it boomerangs after some time. But if you have a very transparent, like people are very educated nowadays. They get information from the net and other things. So here they have been very frank in saying that so many side effects are not understood. So that is the way to win the trust. And then this is, I can use this slide for those who are having blind faith in vaccines. So I going to create some vaccine hesitancy. But again, as I said, you have to balance if the deaths are more from a disease, you have to err on the side of safety. So those who are do not believe in vaccine, I show them the next slide. These are the next slide. The how the vaccination have brought down the morbidity and mortality from very killer diseases like smallpox, diphtheria, measles. You see, this is the American data, 20th century, and this is the 21st century after 2000. So smallpox have been eradicated, zero. Percentage degree is 100. Diphtheria is from almost 1.1 lakh 75,000 to just four cases, and decrease is 99.99% diphtheria. Measles is again from almost 5 lakhs to 81, and again decrease is 99.98% by the vaccination campaign. Mumps again 99%. So most paralytic polio is almost 100%. Rubella 99% decrease over the from the 20th century to the 21st century, 2000. So these figures show that vaccine works actually at the population level. It brings down. Of course, there are alternative proponents also. There are proponents who say, ki, no, it is the overall development, hygiene, sanitation improved, and then before, without vaccines also the disease could have been brought down. So that the data is not so strong as the data for the vaccines. And if you see, the hygiene sanitation can only reduce the bacterial diseases, but it has got no impact on the, say, smallpox or measles, on the viral diseases, Only the bacterial disease, waterborne disease, and they can't come down. And tetanus, of course, you have to have a tetanus vaccine because you cannot eradicate it by any means because it is in the soil, it is in the animal dung. So tetanus vaccine is important. So these are the essential vaccines. Okay. Measles also, measles, some people in the developed countries, the measles vaccination uptake became very low, and there have been outbreaks of measles. And it happened during the COVID times also in slums of Bombay and other parts of India because the measles vaccine was neglected and a measles outbreak took place uh, in slums. And in the armed forces also, I have seen, I was serving in the armed forces in 2000 to 2004. So we investigated an outbreak. Outbreaks of typhoid occurred in a regimental center. More than 100 recruits, they had typhoid and one of them died also. And why it occurred? Because the factory manufacturing the typhoid vaccine, they had shut down the public sector factory, and there was a gap in vaccination of typhoid, which is a waterborne disease, and troops are staying in barracks, and there are outbreaks. A couple of outbreaks occurred, and then it was reintroduced, the typhoid vaccine. So it does make a difference. And hygiene sanitation, we have a long way to catch up, particularly countries like India and some parts of other Asian, African countries. So at least require vaccine for the time being, and hygiene sanitation will not eliminate the viral diseases. So the strategy has to be proper communication to community. More needs to be done to properly inform the public. As I said, these film stars and all are social marker. In fact, people who are discerning, who are intelligent, they will become suspicious. Why you have to sell vaccines like Thumbs Up or Coca-Cola if it is good? If you tell the advantages, you tell the side effects also, you tell the normal pros and cons, so they will have more faith in all the health workers require proper education because in the COVID times, many of the health workers were not aware of the side effects and other things. So to first to